Thanks for joining us for today's edition of Wellness Wednesday. Today, we are very pleased to feature the President and CEO of Vitality Integrated Programs. Ester Quilici joins us in studio. It's a very special edition of our program as we get to chat with someone whose business has made an enormous impact on the quality of life here in northeastern Nevada. Ester, welcome to the radio show.
I'm glad to be back. And happy spring. It's a beautiful day. And I enjoy speaking with you, Lori. Thank you for inviting me.
Thank you so much. We're going to divide the program up a little bit today, Ester, because it's pretty fascinating when you consider the past, the present, and we'll reflect, of course, envision the future for this local Vitality Integrated Program Services, because you have come a long way in more than 50 years, if you can imagine that.
Yeah, it's been 53 years. I'm very happy to talk about the retrospective and the future.
So Vitality was begun in 1971, and this was a really crucial time. This was a drug and alcohol treatment center, but from the research I've done, people I've talked to, and I don't know that Elko is that different, but Elko was still locking up people who were under the influence. You went to jail. You went to dry out, sleep it off. People suffering addiction were driven out of town. They were often disowned by their family.
Let me give you my perspective of what I know. We were founded by a private-public partnership, which is evident even today. And what is that private-public partnership? The Fed came to a very small rural frontier Nevada town and spread the word. Is anybody here interested in joining a community partnership to help alcohol and drug problems in the community? And they got people to sign up. And lo and behold, 53 years later, here we are. And so what Dorothy provided when she first got here is, first of all, strong foundation in recovery from substance use disorders, we call it now, and a vision. And she also worked well with the state because, again, there was a public-private partnership. Had it not been for the state of Nevada to create a state agency that funneled some of the federal money, you couldn't get these programs to have gotten off the ground because there was no local support monetarily anyway. There was public support, but not monetary support.
Vitality Unlimited and now Vitality Integrated Program Services remains a nonprofit. So what Ester was just describing is this community effort, concerned individuals who came together, needed that federal funding source, which is what we still require today. We're discussing with the President and CEO of Vitality Integrated Program Services, Ester Quilici, because we are in the present now in our discussion, talk about the impacts of those wraparound services you described. The Certified Community Behavioral Health Clinic was really piloted or pioneered here.
I think, I was, we were a demonstration project in 2016. There were 3 demonstration projects in Nevada that survived. 8 states were given the opportunity in 2015 to develop these programs. And we started in 2016. So we have a rural frontier program here in Elko. We have one operating in Carson that's a rural. We have one in Dayton. And we developed an urban CCBHC in Reno. Because when we started, there were less than 60 CCBHCs. We showed that the concept worked and how it could work in different locales. Now there are over 500 CCBHCs in the country. And so with the wraparounds, what it did is address the whole person, because not only do we do mental health and substance use disorder, but we address the physical aspect of a person. And that's what it means to wrap around. And we can provide peer services, we can provide targeted case management, and those services are really called out through the Medicaid program. Unfortunately, private insurances don't pay for peer services. What is a peer? It's someone who has lived experience. These are people that can give you advice from their lived experience, how they've been successful, how they stay sober, how they address their mental health problems. And these targeted case managers just help a person define what it is that will help them be successful, what services they need, and help them access these services. So those are the wraparounds that address the whole person. And I think individually, you get at it's almost like the home, medical home, if you've heard about medical homes in the medical vernacular, because it has one person that provides the direction of the individual and then calls for the wraparounds. So you have, it doesn't have to be uniform, it just has to be individualized.
Individualized, whether you're a teenager or a veteran, a senior citizen, a working professional, right, Esther? Because we know that these are the lives that are being impacted.
That's right, and it's confidential.
So with the variety of services that people have available to them, you could probably sit back and say, wow, I've been there, done that. We've seen a lot. What's to come, right? When it comes to either Vitality or the Elko community, obviously we need to do more.
Well, what's to come? I mean, when opportunity knocks is what's going to come. We're looking at a van program that's sponsored through the opioid money through the state of Nevada that might reach all the outlying communities outside of Elko. And so we were just talking about that negotiation this morning. That's one of the things that might come. We may expand again. We may go to Las Vegas, and we have a partnership down there that may turn into another clinic. And we're just going to wait as opportunity knocks. And it's not that we're not looking for opportunity too. It's not we're passive. We just are going to see what happens. And then, we're waiting, like I said, on hoping that there are no major changes so that we can continue to provide the work we're doing. And in Reno, we're expanding into IOP programs for adolescents. We're working with children. We are working with some of the MCOs that have money that's available for grants to provide services to kids. And those are the things that we're looking at right now. The Medicaid world is going to be changing in the state of Nevada in 2026. It's going to go to MCO, managed care organizations, which are difficult to deal with, lots of red tape. And unlike the state that was in business with Medicaid to help us provide services, these MCOs, number one, are here to provide themselves with an income. That's my humble opinion. Then they next want to provide services. I mean, we're navigating that right now. We've been working with MCOs for years, but now they're going to be into the residential part of alcohol and drug treatment. And it's PT93 is this new category. And it is, I think we're going to have two MCOs out here in the rurals, and then I think there's 6 of them all together. We are trying to make a good connection with them, have a good rapport, and do the job we need to get people treated from the Elko area, from any of the other areas we operate.
Well, Esther, again, opening the door to future conversations. You mentioned Dottie. Dottie Dexter is your trusted CFO and advisor, and you are both, it is apparent, you are both active in running this business, which is now statewide in Northern Nevada, as you alluded to, could be headed to Southern Nevada as well. Recognized for decades of contribution to this type of healthcare. And I guess in closing, until we meet again, what you want people to know about this business, which is your life's work, because it truly can't be easy. You must have been tempted to walk away before, but maybe your Jesuit training, your background, your education wouldn't let your heart go that direction.
Yeah, it's had some dips. It had some real heavy lifts, and we've had some troubled financial times because of the change in the healthcare financing and the lack of finding people to come into a rural community in Nevada. and that has lifted a little bit. And we've had some strong support from the city, some real advocacy there, strong support statewide, and I think that's been a great boon to this company and the people with whom that work for us. And so for this future, I think that we want to lift the stigma and have people feel not so self-conscious about getting help, or not feeling that it's such a moral issue or spiritual bereavement to seek services. I think we have made headway. I know we've made headway because we have a large census, and I think that all over the state. So that's a good thing. And our profile, I think, has risen as a company, and I think it's important that people know that, because I think that we're more visible. The help is more visible. That's what I mean, is our profile has risen. They know that there's help in the community. Not only us, but there are others. But we do provide a full service delivery system, cradle to the grave, wraparounds included.
Thank you, Esther. We really appreciate your time. Ester Quilici, the CEO, Vitality Unlimited, Vitality Integrated Program Services, Community Behavioral Health Clinic, a nonprofit. And until we meet again, it was great to catch up with you. It was wonderful to reminisce about Dorothy.
It was. Thank you. Yeah, happy trails to you, too, until we meet again.
Thank you, Esther. And thank you, listeners, for joining us